Thank you for joining us here on the Beyond the Doctor's Lounge podcast. Today, I'm excited that we have a guest, Dr. Bertina Hooks. We met on LinkedIn and we had a wonderful conversation about her vast experience both in clinical medicine and her broad experience outside of clinical medicine and her non-clinical career. So, Dr. Bertina, thank you so much for coming on today.
Thank you so much for having me on, Dr. Coleman. I really appreciate it. And I'm really excited about your podcast.
Oh, thank you so much. And I appreciate your support of the podcast as well as our group. I've seen you in the group answering questions, and thank you so much. I
Well,
love it when we women docs are in community. So,
I do too.
yes. So, Dr. Hooks, can you go ahead and tell us a little bit about yourself, whatever you want to say in your introduction to the audience?
My name is Dr. Bertina Hooks. I'm a board certified internal medicine doctor. I've been practicing for over 14 years. I live in Dallas, Texas with my daughter. I primarily practiced as a hospitalist for years. And then recently in 2023, I transitioned into non-clinical medicine. But throughout my career, I kind of have wanted to pursue non-clinical things. I actually established my own practice in Northern California for years.
Wow.
I did locums for a long period of time, and then I've kind of gotten involved in non-clinical work, doing utilization management for the last 2 years, and then I've also been doing medical expert witness work as well.
Wow, wow. That is so interesting. We've had a guest talking about utilization, and so many docs are interested in it and having a hard time breaking in. So, can you share a little bit more about your career pivot? What drew you to hospital medicine initially, and what motivated you to explore options outside of medicine?
Well, I've always wanted to be a hospitalist since I did my internal medicine residency training. I was always enjoyed more of my inpatient rotations rather than the clinic months. But I did do outpatient work for a long time on my own and then working for other companies. But I think what drew me to hospital medicine is that, a lot of times when patients are in the hospital, they really have like catastrophic events are happening. So they have health concerns that are trying to be addressed, diagnosed. Maybe there's concerns for stroke or a heart attack or something like that. And so it really is an opportunity, one, for you to kind of triage people
Yeah.
and different medical complaints, and also to diagnose and treat them and to provide education. So, a lot of times patients may not know maybe the risk factors for a heart attack or a stroke, but once they're diagnosed with one, that's really a means to educate and provide like some primary and secondary intervention or prevention for patients. And so I really enjoyed my role because I really feel like being a hospitalist, you really learned how to manage the how the hospital operates and optimizing it to get patients in and out quickly. And so I loved that process, and being involved in hospital committees and peer reviews and things like that was always something because I just love being in the hospital. I love working in the hospital with patients and nurses and all of the other ancillary staff that are there, as well as other clinicians, other physicians that are specialists and things that you have to interact with. So I love that. And there's always something that's changing. The acuity in hospital medicine is always acute. So when towards the middle of my career, I was kind of doing a little bit more administrative roles and clinical roles, which I enjoyed. But really what made me want to pivot out of hospital medicine was the coronavirus pandemic.
Oh,
So the pandemic was definitely a change. I mean, that was the first time in my career where I ever dealt with something that was so novel, so new, and you really had to keep abreast of what was happening day by day, minute by minute. Because this is something we had never seen before, never experienced, never treated before. And so I love the challenge of that, but I also was concerned about the risk of that, to me and then my immediate family, because I'm a mother
yeah.
and I wanted to make sure that my daughter was safe. So I did a lot of locums work during that time. I have multiple state licenses and I worked in different COVID units throughout the US. And it kind of took its toll on me. I mean, it's a lot of hard work. It's very rewarding work,
Hmm.
to help patients in that. But this, it's also very challenging because we saw a lot of patients that died or have comorbidities or due to COVID. So it definitely was challenging work, rewarding work, but then also I wanted to kind of see what else was out there, maybe do some non-clinical work. So actually in 2019, I started interviewing and applying for non-clinical jobs. I primarily was looking at clinical decision information, or CDI,
Uh-huh.
and utilization management jobs. And so I was looking for jobs either for a healthcare system working as a physician advisor,
Hmm.
or as a medical director working for like a major insurer. So I
Okay.
started actually working for a major insurance company in 2023
Okay.
full time. And then before that, I was doing some independent contractor work as a physician reviewer, which kind of got my feet wet and kind of I started to like it, but I was still working primarily full-time clinically. So that kind of that was the reason for my pivot.
Yes, yes. And well, my next question was going to be about how you began the process of transitioning. I know you just went a little bit into that, but what were some of the steps that you took when you did decide to explore some non-clinical roles?
Well, I started talking to and networking with other physicians who were in non-clinical positions to kind of figure out if maybe that would be a good fit for me or something that I would like. I also got involved in there's a lot of Facebook groups for clinicians and physicians who are interested in utilization management or just non-clinical work in general. So
Yeah.
like your Facebook group. So, you can get a lot of information from other physicians about the questions and read the responses to different posts and things like that. And then finally, I just kind of did a search on LinkedIn. And indeed, there's a lot of, like, if you look for physician reviewer or medical director
Hmm.
positions, utilization management, a lot of positions are posted on those job searches.
Hmm.
And I just kept applying, just like I would maybe if I was looking for a clinical position. I
Right.
updated my resume, tried to kind of look at skill sets that I could highlight in
Hmm.
my resume, and just applied in persistence because it's a very competitive field, unfortunately.
Yes.
And so you really have to be persistent and just keep applying.
Yeah. Now, I know you mentioned that you were looking at physician advisors, medical directors, and physician
Yes.
reviewer. Can you tell us the difference between the three of those in general?
Yes. So a physician reviewer is someone who's a physician, obviously, that is hired by usually by an independent review organization, or those are companies like Alpro or KeyPro or AllMed. Those are basically third party companies that review medical records and help make determinations. So they're either hired by the insurance companies or healthcare entities to do reviews or appeals or things like that.
Okay.
You kind of utilize some of the same skills and resources that someone like a physician advisor or medical director for an insurance company would
Okay.
do. A medical director is usually the title that's given to a physician reviewer for an insurance company,
Hmm.
like any of the major insurance companies like United Health
Right.
or Humana, Cigna. Those are positions usually are called medical directors. And so it can be compartmentalized by the insurance company where you do like certain types of reviews and
Mhm.
peer-to-peers, like maybe inpatient versus outpatient reviews, or DME or pharmacy. But the role is pretty similar to the physician reviews. It's just not a 1099 contracted
Okay.
position. It is an employed W-2 position with an insurance company.
Okay.
And then a physician advisor position is where you're a physician that works for a healthcare entity. So you're hired by a healthcare entity like HCA or like a major hospital or something like that. And
Right.
you do the reviews of the admissions and basically decide if it meets inpatient criteria or not, just like the other positions do. And
Mm-hmm.
then you also provide a peer-to-peer. So that's usually, it could be a W-2 employee position. It's usually a contractor position, but that also, so they all do utilization management. They look at different cases when patients are admitted to the hospital, whether it be they have Medicare, Medicaid, or commercial insurance. And then basically what you're determining is, do these patients meet criteria to
Mm-hmm.
receive reimbursement for inpatient level of care or not?
Right. Okay, great. Thank you so much for making the distinction between those three different jobs that are similar, but all have their own little nuances that are slightly different. Thank you, Dr. Bertina. And when you were deciding to make your shift from full-time clinical to non-clinical, were there any mindset shifts that you had to make? I know a lot of physicians, when I'm in the forums, I see that they wrestle with different thoughts about their career pivot or fear or what have you. Everyone's journey is different. Were there any mindset shifts you had to make, or did it flow pretty naturally?
Yes, I think so, because I think a lot of physicians are trained to be clinicians and be
Yeah.
physicians and to take care of patients. So we don't you realize that our degree can be utilized in other ways. So I think you have to have a growth mindset. And a growth mindset basically means that you have the mindset that what skills you possess are not fixed and weren't born just with, you can acquire new skills and over time, and that you don't have a set number of skills only. And I think that's important to have, because I think most people who go through their medical education and training think, I'm going to practice medicine, see patients until I retire. But
Mm-hmm.
there's a lot of things that having a medical degree can be utilized to do. You can
Right.
utilize your medical degree to do non-clinical work like utilization management. You can
Mhm.
be a medical expert. You can be a medical writer, a
Right.
speaker. So there's a lot of things. You can even create medical applications. If you're interested in like television or TV, you can be a creative consultant for different television shows like ER. I
Wow.
have a friend who's an ER doctor who was a creative consultant for those. So whatever
Wow.
you have a passion for, you
Mhm.
really can utilize your degree. And I think a lot of times people don't realize that you should utilize your degree as a means to an end. Hopefully
Yes.
utilizing your medical degree as a means to do things that you would like, maybe even if it's not clinical, like doing real estate
Hmm.
or investing. There's a lot of things that you can utilize your degree, or I guess even the income that you make from your degree, to invest and diversify into different things.
Absolutely. Absolutely. I feel like that's something that, like you said, in medicine, many times we think that's the one thing that we can do. Whereas people in other careers, I feel like they tend to be more open as far as
Exactly.
transferring their skills to other occupations and opportunities. So that's definitely an important mindset shift. Once you have that degree and that training, it's yours to apply as you want to. So,
Correct.
yeah, for
Definitely.
sure. What advice would you give to someone who is just starting to explore their non-clinical career path? Maybe they're feeling overwhelmed by the options, or perhaps they're so burnt out that they can't see their options. Do you have any
Right.
words of wisdom?
Well, I think they have to reflect on what their passions and goals are. So I think, like I was feeling at that time during the pandemic, I was feeling very overwhelmed with my clinical responsibility. Sometimes you have to take a step back and figure out what really truly makes you happy, and
Mhm.
what is your purpose in life. And I think finding what your purpose is and what your goals and values are will help lead you to the career paths that you want to pursue. So one of the things was I wanted to help people, and I think I definitely helped people as a clinician taking care of patients, one patient at a time every day. But
Yes.
I think working for in a non-clinical realm, you can help multiple patients just by doing cases like being a medical expert witness or being a writer or a speaker. You can help raise awareness of issues that are going on that affect hundreds of thousands of patients, not just one. You can also help change policies and criteria constantly insurance companies are looking at things and changing guidelines and things like that based on evidence-based medicine. So just because you're not practicing clinically doesn't mean that you're not looking at the overall good for patients. I think in addition to finding your purpose and figuring out what your goals and passions are, once you define that, then you need to reflect and say, okay, what kind of things am I gravitating towards that I'm interested in, and do some research about what those different roles involve. A lot of jobs like doing utilization management or CDI or pharma does require, like, the company does provide some type of training, but you're essentially using the skills that you've already been fostering and developing throughout your clinical career: diagnosis, treatment, so the standards of care. Even as a medical expert witness, you're constantly being looked at. What is the standards of care? That's something that you're aware of because you've been doing it for years. So that's what makes you a medical expert, because you've been practicing actively and taking care of patients for years. In order to get into a lot of like utilization management, for instance, you have to be practicing or out post residency. So you have to be board certified, you have to have an active license. You don't necessarily have to have a DEA to do utilization management per se, but you do have to be out and have been done post training at least 3 to 5 years to be considered for most utilization management jobs. I don't know what the criteria is for pharma or for CDI, but for utilization management, it is pretty clear that most companies won't hire you unless you have those requirements. And then I think it's just a matter of updating your CV to highlight those skill sets and then applying. Some of it is a numbers game and just being persistent and applying. But I think those are the real things, is reflecting on what matters to you. And even if not the typical non-clinical things that physicians go into, like utilization management or pharma, look into real estate, look into medical applications if you're very tech savvy and like, programming and coding and things like that. There's something just for everyone, and there's no limits in what you can do. It's just about having a business idea and having a solution that can help others and then implementing it.
Yes, because we're just like anyone else out there in that we can pursue whatever path we choose to pursue. So, ladies, don't limit yourself. If you're on your career pivot or contemplating it and you want to do something that's outside of the box, that's okay. You do you, you really.
Right.
And
there's a lot of people that are coaching, like people have gone before. You can get a mentor, someone who's actually pursuing something that you're interested in, and get their advice as well. That's an excellent resource as well.
Exactly. And I have a colleague from the hospital that I practice at who recently pivoted from his surgical career, and now he's doing full-time real estate. So I think that's, really awesome. Now, Dr. Bertina, you also mentioned expert witness. So far, we haven't really had a guest who's talked much about that. Are there any insights you can give us or tell us a little bit about the expert witness opportunities or how to get into them?
Yes. So there's a lot of expert witness opportunities. There's a lot of opportunities in medical expert work. And the main types of cases are either medical malpractice or a personal liability or injury. There's more personal liability or injury cases than medical malpractice.
Okay.
But I think the easiest way to get into medical expert work is there's a lot of Facebook groups that medical experts kind of share ideas and things like that. So, get involved in those.
Yeah.
There's also a lot of books out there. There's even the SEAK program, SEAK, where you can learn more about medical expert witness writing, speaking, all of those things. That course is, I guess, given by a lawyer.
Okay.
And they give a lot of insight into kind of what the lawyer's looking for from a medical expert witness standpoint.
Okay.
There also are a lot of databases. So I would definitely, if you're interested, you update your CV, list your experience. And the main criteria is that you have to be board certified in your specialty.
Okay.
You need to have no medical board sanctions or DEA sanctions, pretty clean malpractice record.
Mhm.
You have to be actively practicing and seeing patients. It also helps if you have particular niches, like maybe you're a hospitalist and you've done a lot of transplant medicine, or
Mhm.
you're a hospitalist and you've done a lot of cardiac medicine.
Uh-huh.
So it's good to highlight those experiences and where you worked in your clinical experience. And then there's a lot of databases. Some of them are free, some of them are fee-based, so you have to pay for them, but you can sign up for those, and then those databases will help connect you to lawyers who are looking for medical expert witnesses. So the
Okay.
main database I use is AFMS
Okay.
and Expert IQ. Both of those are free databases to sign up for. And basically, you have a profile there that lawyers can look at, and then they can send you cases to review. The process usually entails some type of interview or Zoom meeting with the lawyer, and they may ask you some questions, make sure there's no conflict of interest, and
Okay.
then they will determine if they want to select you to do the case.
That's good. Do you think that that would be a good option for some of the docs who are slowly making the transition? Like, I know I've spoken with a few doctors who have gone from full time to a per diem or part time.
Mhm.
Maybe that would be a good way that they could back up and do less practice, maybe recover from burnout, spend time with their families while still
Yes.
bringing in a good income from the expert witness.
Yes, because the expert witness, I mean, for one case, depends on your fee schedule that you determine.
Mhm.
And there's websites online that can show you kind of what the average for the area, like that you're practicing in, or what specialty you're practicing in, what are comparable or competitive hourly fees and retainers. And it's very lucrative. To do one
Wow.
case, you can get up to six figures depending on your involvement in the case. So it could be as simple as a verbal opinion, or
Okay.
you could have to write a report, or you could have to testify in court, or be
Okay.
retained to testify in court. So
Mhm.
the legal process can be very slow. And so basically they need an expert to look at the case and determine, is there causation, is there negligence or not,
Mhm.
is there deviation from standard of care, and what your opinion is on that. That's basically what you're answering.
Right.
But definitely, and also the best part of medical expert work is that you can do it at your own pace. You set a retainer or hourly fee, you get paid for your expertise, and you work at your own pace.
Mhm.
And I think it's very lucrative, and it's definitely a nice work-life balance because you can work on your own pace but make good money. Sometimes the cases are far and few between, sometimes they're more frequent. Once you get your name out into the community, once you start developing a relationship with a particular law firm,
Right.
you can definitely get a lot of casework.
Wow, wow. So that sounds like it could definitely be a great opportunity, especially like I
Definitely.
said, for the ladies who are backing off slowly from clinical practice. So
Definitely.
thank you so much for sharing those tips. So
Hmm.
hear that, ladies, expert witness, think about it.
Definitely.
Yes, yes. And for physicians who are getting ready to start their pivot, but they're a little unsure about where to start or how to start, what
Mhm.
tips or advice do you have for them?
I definitely think thinking outside of the box, being innovative, having a growth mindset,
Mhm.
looking at all your options, kind of talking with others who are in fields that you're interested in, whether it be pharma or or medical expert work, get their opinions on, their process. And I think eventually you have to make that leap. So you
Yeah,
have to, once you've done your research, and you kind of decided what avenue you want to go into, you need to update your resume. You need to get involved in different networking. Even as a medical expert, I used to send like my fee schedule, resume, and like a letter to
uh-huh.
local malpractice lawyers. It doesn't have to
Wow.
be very involved. It can be very simple to get your name, and you sign up for those databases or things like that, or you apply for those positions and just get your foot in the door
Yes.
and get that experience and kind of figure it out. You may decide that it's not for you. You want to go back to clinical work, but
Right.
I think it's good to explore it and to look into it.
Absolutely. For sure, for sure. And as we wrap up, Dr. Bertina, can you tell me What aspects of being non-clinical you're enjoying as far as your lifestyle? What advantages, or is there anything that you're enjoying about the non-clinical lifestyle that's different from when you're practicing clinical medicine full time?
Yes, there's a lot that I enjoy about non-clinical work. I think the most important thing is having autonomy
Yeah.
and work-life balance.
Yeah.
I can pretty much work whenever I want to at my own pace, set my own hours, and that gives me a lot more time to spend time with my family, with my daughter primarily, to
Right.
pursue hobbies and interests that I like, travel, things like that. It's definitely less stressful than working clinically and being on call because your schedule is not your own. I definitely like also that it's somewhat more lucrative because you set your worth. So what I mean is just like like if you're working a locums job, you would set your call rate or whatever or hourly rate. Same thing with this. You set your hours of business of operation, you set your fee schedule. All of
Mhm.
those things are determined by you, so you determine your worth.
Yeah.
And you can always say yes or no to different opportunities, so you have that autonomy, which I really like. So some cases I've been presented and I don't feel it's a good fit for me because it's not really my expertise, but maybe I have a colleague that has better experience than I do, so I would recommend them. Or sometimes I feel like I'm definitely the right person for a particular case and I feel like I can do a great job, and that sets yourself up to more success and more referrals. It's a very lucrative market. I think it's a work-life balance. I don't work any nights, I don't work any weekends unless I choose to.
Awesome.
I set my own schedule and I have more time with my family. I'm more present. I feel that I'm less stressed out and I have more time for self-care for sure.
I hear you. I find the same thing with my non-clinical position. I definitely go to work. I work. I mean, when I'm at
Right.
work, I'm at work. But when I'm not at work, there's more bandwidth for other things than what I ever experienced in clinical medicine. Though those years were rewarding, definitely good to have that additional energy and time for the things that
Yes.
matter.
Yes.
Yes, yes. So as we wrap up, any final parting words to our audience?
I would say that I know a lot of clinicians are feeling burned out. I feel that they're feeling like they want to pivot or transition. And I definitely think if you do want to transition, there are a lot of possibilities and opportunities out there. Just do your due diligence, do your research, figure out what's best for you, take your time.
Yeah.
And then once you have made your decision, go for it. Don't let fear keep you from pursuing something that could really be something very rewarding, just as rewarding as clinical medicine, and just as fulfilling, just as financially rewarding, and
Yeah.
also something that can help you have a better work life balance.
Exactly, because life goes by fast, and
It does.
so sometimes we have to take those opportunities, when we decide that they're right for us. So
Definitely.
wonderful. Well, Dr. Hooks, where can our audience find you if there are some docs out there who want to connect with you, find out more, about your career path, ask you questions? Where can they find you?
Well, I have a Facebook and Instagram accounts. I'm Dr. B Hook underscore Hooks on Instagram. I'm also on Instagram at Pinnacle Business Academy, which I work as a clinician that helps other clinicians figure out their career goals, help them make that pivot. So you can
Uh,
go to pinnaclebusinessacademy.com, which is my website, read
okay.
more about the services that I provide. I provide one on one group coaching, webinars, some ebooks, and I'm definitely willing to help clinicians who are struggling with the decision to pivot into different areas of medicine or non clinical avenues for sure.
Great. That kind of support is really needed out there. So thank you once again, Dr. Bertina Hooks, for being here on our Beyond the Doctor's Lounge podcast. We definitely hope to have you back one day, and we'll see you in the group.
Thank you.